Neutral.
90?
Yeah.
And then what?
Invert.
Invert.
So invert? Am I checking integrity of the ligament?
Yep.
Yes.
Yeah.
So do I want to kind of snap it?
Mm-hmm.
Yep.
Yes. Check the integrity.
Snap.
I'm not
So snap.
seeing necessarily how far it goes.
Okay.
Right? I'm checking the integrity of the ligament. True?
True.
Got it?
Mm-hmm.
What's the next one?
Cleagers.
Figures.
Either one.
Oh, what is
So
it?
how do I do that? Oh, so what's a positive sign of this?
Pain
no
and
laxity.
laxity. Concordant sign.
Laxity, end feel,
And it could be pain too. With the
pain, could be.
Right.
But if a positive test would be, I'm probably not getting a good end feel, right? It's kind of, it's either soft or it's not there. Agree?
Mm-hmm.
Because that's what I'm checking. I'm checking the integrity of the ligament, right? The next one was Kliger's. Okay, so how do I do that one?
Dorsiflex and evert.
Dorsiflex? Do I stabilize anything?
You could.
You stabilize
I
the
better.
same spot.
I can't do this. I can't do it without it. Can I? So I stabilize. Dorsiflex. Then what?
Invert external
Yep.
to the foot.
And what's a positive?
Concordant sign.
Concordant sign. I'm not checking the integrity of those ligaments, am I? What
Mhm.
ligaments are they?
This
Could be the
is
deltoid,
Yeah.
and it could be the anterior tibial.
So it could be
Could be
the
the
medial
deltoid,
deltoids. You can use this for that. But also primarily it's used as for tib-fib ligaments. The integrity of the ligaments between the tib-fib bones, right?
Yep.
So I need to stabilize and do that. So a positive would be
Concordant sign.
concordant sign. Next one,
Anterior drawer.
anterior drawer. So do I need to stabilize anything?
Yes.
Yes.
Tib fib.
So I need to stabilize. Then what?
Grab the back of the heel.
What
Or-
angle do I need here?
Plantar flexion.
90-90, or do I need a little
Plantar
bit of
flex.
plantar flexion?
Plantar flex.
I'm gonna need a little bit of plantar flexion. Actually, if I'm on this leg, I'd probably do it this way. So I'm gonna need, because I wanna stress which ligament?
ATF.
What about the talar tilt? Which ligament am I stressing there? Calcaneal fib. This one, more the,
Mm.
which ligament? Anterior
Talofibular.
talofibular. So I've got, I don't know, maybe 20 degrees, maybe, well, not 10, maybe 10 degrees. Am I gonna just check laxity, or am I gonna check the integrity?
Integrity.
More than integrity with this. So I'm gonna do a kind of a quick anterior drawer. I'm gonna compare the two. Right?
Mm-hmm.
So a positive sign is
Concordant sign.
maybe a lack of end feel or soft. I might, when I compare the two, there may be a translation difference, right? You okay with that one? Is that it for the ankle?
One more. Windlass.
Windlass. So I'm gonna need, let's pretend. So I'm gonna need, she doesn't have to be weight bearing, does she?
Mm-mm.
So she could either be sitting, and there should be we're gonna have to get something to put your foot on, or she could be standing on it. But her toes need to be off the edge, right? And so, do I have her lift the toe up, or?
The clinician does.
So I passively do it so that I can flex the distal phalange, right? And why would that be?
To test just the fascia.
Just the fascia.
Yeah.
What if I have it fully extended?
You're using some of your flexor columns.
Exactly.
Yeah.
Right? So that's to take that out. Good. So she's, let's say, standing, and her toes are off the edge, and I am now extending the great toe, but I have the distal flexed. So the distal needs to be flexed. What's a positive sign? Concordant sign. I'm not checking any laxity or translation or integrity or any, right? It's, am I getting a concordant sign? Good? So it's easy to do, but you need to know what you're doing. Yeah, we'll have to get a platform of some sort in here.
Stepping, those step things.
Yeah.
Yeah,
there's-
we've used them
Are they out there?
Yeah, they're back there, yeah.
Now we got
What's the next one?
meniscus.
Knee,
knee.
now we're on the knee.